Hello, everyone. It's Dr. Jensen from Dean's Chat. If you're on the fence as to whether you want to join the American Podiatric Medical Association, jump on in. It's a new APMA. Whether it's advocacy concerns, scope of practice, billing and coding, consider membership at the APMA as your professional insurance. Hello, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the host for the Dean's Chat podcast. Once again, I'm joined by my co-host, Dr. Johanna Richey. Hi, Joe.
Hey, Jeff. How you doing?
I am doing fabulous. This is a timely episode because I need to get my continuing medical education credits in this year.
Oh, man, I'm so excited. The Western Foot and Ankle Conference is actually one of my favorites because it's held at Disneyland. So selfishly, I get to indulge in both my CME and a lot of fun playtime. And it's even more fun now that we have kids. So I'm really excited to interview our guests today.
Well, I'd like to introduce representing the Western Foot and Ankle Conference, Dr. Christy King and Dr. Devon Glazer. Welcome to Dean's Chat.
Thank you for having us.
In fact, Christy, for you, it's welcome back to Dean's Chat.
Thank you. Yes, I'm excited to be back. It was a wonderful episode before and great to be back with you guys and all the great work you're doing.
Well, thank you. And likewise to you. What we'd like to do is go first names, right? We're pretty informal here on Dean's Chat. Is it all right if we go Christy and Devon and Joe?
Please,
and Jeff?
Go for it.
All right. I'm liking that. Joe, the floor is yours.
Yeah, thank you so much, Devon and Christy, for coming on. It's such a fun thing to get the perspective of some of the behind the scenes of how these large medical conferences work. And so we really appreciate your time. Just to give a brief intro in terms of your current practice setting and then really the roles that you're playing right now for the Western Foot and Ankle Conference. Devon, you are the currently working in Orange County as a regional director for Balance Health, but also a fellowship director. So already a busy practitioner in all of the worlds that you're in, but also currently the chair of the Western Foot and Ankle Conference, past president of the CPMA. And so lots of fun things for us to dive into today. And Christy, you are the residency director for the San Francisco Bay Area Foot and Ankle Residency Program up in the San Francisco, Oakland area, currently practicing in Oakland, Kaiser Permanente, and also functioning right now as the scientific chair for the conference at the Western that will be held in Anaheim, June 19th through the 22nd. I'd love to start with, how do you begin to put something like this together?
So it's actually an 11-month project. Basically, after the conference is over, we get some sleep, and roughly about 4 to 6 weeks later, we kind of start again. And we do a post-recap meeting where we kind of look at what we did the year before and go, okay, well, this was good, and maybe we can make this better. And we start from there. And so we never kind of sit on laurels and just kind of think, how can we be different and better than everything else that's out there? I think it's just inherently our competitive nature, but I think it's also to make things more enlightening for those that are attending, right? I mean, no one wants to hear the same thing over and over again. So we start with that, and we actually look at our reviews and we take what the reviews say into context and then kind of go, okay, well, that's a good point, or that's a good point. And then from there, we conceptually develop how the meeting works. We stick with kind of certain subjects that are always going to be, podiatric based. So between like biomechanics, surgery, infection management, pediatrics, trauma. And then we pepper in all the other things that are kind of new and innovative that, are maybe different from the year prior. So the interesting part is, as we develop this and we really start kind of hitting away, like what is our lecture going to look like for each section, is that sometimes we have to change things along the way because something new comes out or something different information-wise comes out. And we carry that all the way into the fall with several meetings amongst our committee members. And we all kind of put in our input and, who do you know, who would be good on stage, who has a good presence, who has good data, and can really bring light to something that, that hasn't been out there or is new. And because we want that fresh information. Our goal is to kind of have the series set by somewhere in January, but that staff would kill me for saying this, but it normally kind of trails out a little bit longer than all of us want. And we don't want it to be that way, but this is the way that it just kind of works. And that's one aspect. And I will say, this is Christy's first year being a part of this. And it's been an absolute blessing having her, because, the COVID era was very tough. John Livitz was fantastic. And, basically I started under him after terming out as CPMA president, as a committee member in 2019. So it went from things being like really smooth to all of a sudden, oh my gosh, what do we do? And with it having someone like Christy come in, where the atmosphere has changed for conferences, and those that know Christy know her very well, that she's beyond diligent, beyond skilled, and beyond educated. So she brings that flavor in. It really allows the rest of the committee and myself to kind of go and do what we do best. So you kind of get this kind of yin and yang scenario going amongst all the committee members. So a big thank you and shout out to you, Christy, so for coming on board, and you've just really taken it and run with it. Everyone that knows me knows I'm chatty, so I don't want to steal any of your thunder. So Christy, I don't know if you have any comments in regards to how we developed this as well.
I agree with you, and I thank you for having me on this. And I totally have enjoyed kind of being the yang to your yin, or whatever it's going to be. But I think we've worked really well together, and I've really enjoyed the process. And it was my first year kind of coming into this and just seeing how much it is an 11-month long process, and really throwing ideas off of each other in the committee to see how we can make it the best it can be. And, hopefully I'll be asked back again. We'll see how this year goes. But, in knowing how everything runs, I think, each year we're going to make it bigger and better. So I'm very excited to be a part of it.
Yes, we will ride together again. And then also, thanks to Dr. Park as well, and Dr. Mansdorf are also part of the committee, and have been helpful. Dr. Mansdorf has been part of it longer than I have, and really just kind of running our labs and kind of speaking to that. What we've changed, we used to have wet labs downstairs in the basement at Disney, and they were good, but there's a lot of constraints with doing that. There's a lot of CPME constraints with doing it to kind of make it right. And, vendors don't want to necessarily give equipment without being shown. And that's understandable. Like we get that completely. So post-COVID, came up with this concept called the Innovation Hub, where basically we have these very large vendor hubs within the exhibit hall, and we provide them power and we provide everything. So you could it's a dry lab, but you could do a dry lab on the floor. So that way you can understand, like, how does this new equipment work? How can I get it in my hands? And for those that are coming to attend, the cool thing is, you don't have to go to 5 different places to kind of see everything that's out there. You can see it all in one location over one weekend. And with it, this was a big kind of mental reach. We've never done anything like this before, and we weren't sure if it was going to be successful or not successful. And we started this right after COVID, where everyone's like, hey, our wallets are tight. And, before COVID, everyone was very happy to write a check. After COVID, no one was really sure where their company was going. And they're like, well, I don't know if we can do it this year. So I'm almost like a bill collector. And this is why I love having Christy part of it, because she can take care of a portion. And then I do this where I just politely hound all of them. When is your marketing budget coming out? When do you close your marketing budget? So we could develop these hubs, and we started at 4, and we even have what's called the hub hour, which will be Friday night, and we'll talk about that a little bit more. Where basically it's a platform for them to invite certain doctors to come look at the equipment a bit more one-on-one, versus kind of having a dinner program where maybe nothing really gets looked at and no one really kind of pays attention. And the cool thing was we started with 4 a few years ago, and now we're at 6 of these hubs. So we've expanded. I would love to give a big shout out and appreciation to our hub sponsors. It's Fusion, Stryker, Total Ancillary, Treece, Paragon, and Voom. Fusion and Voom are new, and the other ones have been supporting us for the past couple of years. So we appreciate everybody all the way around, doing this because I think it's going to really change how we educate. Because the reality is, I can set up a wet lab, but we used to always say like the screw's the screw. Well, not so much anymore with all the MIS stuff that's out there, because a jig is not a jig. This jig is different from that jig. The screw may be similar, but the jig is going to be much different. So when you talk about educational formats, and you really need to have your vendor buy-in, right? The industry buy-in to really show you how these things work so you can master it and do it properly when it comes time to be in the operating room. So,
and I love that, because this idea of a hands-on experience versus, to your point, like a dinner presentation, at some point that's just not as impactful when you want to see how this thing works. And can I put this on and play with it a little bit as a surgeon? Like, I want to see how it interacts with a foot model or a cadaver in some cases. So I can absolutely appreciate that.
I'd love to hear you say that, because that's exactly the goal that we're looking for. From those, obviously we're prejudicial. We think it's a fantastic idea, but we want to hear it from attendees just the same, as well as our lecturers too, that it's a really, really good idea. The other kind of cool things that we've changed up for this year is we've added a few different, we changed up to how we structure the lectures. So instead of having someone at a podium showing slides, we've done a lot more kind of open conversation format, where there's several different lectures, and putting these folks together. It's been a little bit crazy, but it's going to be absolutely amazing of getting, because no one normally does this format. It's like, okay, we're going to change the format. How are you going to make it work? But like this, right? You've built success in Dean's Chat by having this open conversation on whatever you're talking about. And really, when people sit down in a lecture hall, they want that too, right? That's what they want at the end of the day. They want that open conversation of like, hey man, here's my day-to-day struggles. How do I get past these struggles to help my patients? And so we changed it up a little bit. Chris, you want to talk some about it?
Absolutely. So I'm really excited about all of our lecture sessions, but especially sports has been a large part of my life. And I know we talked a little bit of that when I was on Dean's Chat before, but we're going to have a lecture session on the team behind the team, and looking at not just the podiatric physicians, but also other surgeons, nutritionists, orthopedics that all support professional sports teams. So we're really excited to have Howard Lieberskind and Armand Kirikosian lead that chat with a bunch of amazing physicians and allied health professionals that support those teams. Also really excited about our night out with the influencers, which is actually where we're going to have our lovely Dr. Richey kind of lead that chat with Ebony Vincent, and really look at how we can embrace social media to help our profession, not just with patients themselves, but also how do we recruit or show students that podiatry is really a place that would be good for them. So very excited about both of those sessions that are going to be on Friday. And then to follow it up on Saturday, we're going to have a great debate, fiery discussion between Dr. Schubert, Dr. Christensen, and Dr. Hutchinson, where we go over just a bunch of different questions that maybe they've learned throughout their career, and maybe they have a little bit of a different opinion on. And just to see the three of them debate that on stage is going to be a lot of fun.
I have to jump in there, because when I saw that it's funny. I was actually literally texting another friend of mine. I mean, Disneyland's kind of hard to compete with sometimes, but I'm like, I am not missing that. Like, what I told my husband, we're actually, a friend of mine is coming to help support family stuff while I am gone, because this to me is really exciting to listen to those three legends in our profession talk about some of these big pathologies and treatments. And I mean, that's an amazing amount of expertise in one little session that, like, to me, that's like, I can't miss that. So
no, it's been really fun. And Dr. Christensen's been helping me with the PowerPoint presentation, and he's even given me little potential jabs for the other guys. So we'll see how that goes. It'll be a lot of fun.
Oh, that could be really, will that be recorded by any chance, that session?
It
Good
won't.
question.
Yeah, it won't. It won't be recorded. So you have to be there live to see it. So yeah.
No, I was thinking more for posterity. You know, with three legends, it'd be great to capture that moment in time. I'm not even saying, you know, for the conference, but it'd be cool to have it just recorded for looking at 10 years from now.
The Western photographer will be on full duty during all sessions, but especially that one. But you nailed it. It's like you get three friends together that are in the same profession. And you know, it's like saying with my friends, we'll be happy to go at it in a little kind of personal digs that make it, you know, are fun loving. But, you know, I grew up in a Jesuit school, Catholic school environment where we all look at each other. It's like, if I don't make fun of you, you know, I don't care about you, right? This is how we show our love, because we went to an all boys school, and this is just how it all came out. Right. So,
and they're buddies. They're buddies.
They're
that's
buddies.
Why, again, really excited about that.
I know it's going to be fun.
I have a question for you, Christy. So you're going about your day and you get a phone call and someone says, "Hey, how'd you like to be at the scientific chair at the Western?" What was your initial thought on that?
You know, it was actually very interesting. I was on vacation, one of the few times I take vacation in Hawaii, walking with my family when Devon called and asked me to be a part of this. And, you know, education's just been such a big part of my life, you know, since undergraduate. And I couldn't let up this opportunity, this amazing opportunity. And I've had so much fun doing it, you know, through this experience over the last year. So it was probably one of my dream jobs, I guess you could say. So thank you, Devon, for including me in that, and being able to help organize something like this has been so much fun, you know, and we do have a lot of different jobs, whether it's working with our patients, you know, working with our residents, and then obviously a family. So it would be hard not to do this if it wasn't fun in the process. And it's been really exciting to just see how it all comes together, and very, very much excited and anxious, anticipating the actual event that's going to happen, but so excited for everyone to see what we've been working on for the past year.
So well said. Yeah. It's kind of like my kids are excited to go to Disney, but I'm more excited to see what happens with the conference itself, because we're just putting so many new things in place. And just to kind of see that come to development, right? Like this is our baby, and we're just watching it grow over the year. So I'm super pumped. I did want to also mention a couple other things that we've changed up. One, we're having a poster presentation, and this will be for some students, fellows, and residents. The prize money it's relatively ridiculously the amount that we're giving. It's a grand for first, $750 for second, I think $450 for third. And the sponsors for that really just one, it was Balance Health, our company, put money up, which I want to say thank you for the board of our company for doing it. PICA and ACFAS also. So it's a group support for this to make that happen, which it also is going to help support what we call the resume review. So for anybody that's a fellow resident or new practitioner, and they're just going like, you know, I've never made a CV before. What's a CV, right? Like, is that abbreviation for a medical procedure I'm unaware of, or a piece of anatomy? And really show them like, hey, this is how you can make yourself as presentable as you can be, right? Highlight your strengths within that so you get noticed, and just give them some guidance that's there. So we'll have a sign up for it, and there'll be, you know, basically like 15-minute just education sessions. We'll sit down at a table, and you'll get some from gray-haired folks like me giving advice to those that are young and have a prosperous career. So we're excited about that. That's something new and different we haven't done at all. And a huge also shout out to the Podiatry Foundation for supporting an evening, you know, with the influencers, night out with the influencers, to make that come together. They really have pushed to, hey, we have to educate young folks, which means students and prospective students that are out there. So them supporting this kind of social media discussion of the good and the bad. So, you know, we've had a couple pre-meetings. So what we do, just part of the background, is we actually will meet with each section and make sure everyone knows one another first, because that way it kind of opens up the conversation on stage, and especially for Q&A, makes it a little bit more fun for the debate. But so for the influencers, we've asked them, you guys have already found a way of success within social media. Can you also talk about the bad, and how to avoid those pitfalls all the way around? And I think that in itself will be great for those like myself that are kind of relatively novice to it, and trying to, pun intended, dip my toe into the pond, to those that think they may know, but may also learn some new things as well. And actually right before this too, good old Pica, we just had our meeting of what our lecture is going to look like. And it's going to be really focused on, if you're young, how do you avoid falling into a pitfall of illegal action, right? What can you do from the get-go? What behaviors do you need to start day one in your career to avoid that when it happens? And then segue into, those that are in my age group. What am I doing wrong? What am I not doing right with my documentation, or just how I'm talking about complications to patients? So it's those type of things. So you know what to do to keep patients happy and keep them from going down a bad road.
Big shout out to the Podiatry Foundation. I know their new executive director, Gene Pasquarella, is really doing some incredible things and on behalf of the profession. So that's great that they're sponsoring that session on social media.
Yes, he was very excited, and a big thank you to him for putting that in front of their board, because it's a really great sponsorship for us, for CPMA to keep kind of doing what they do. Because really what the Western does is it raises funds to help support CPMA for all the legislative fights that they have, to kind of, keep what we do in California going. When I was president, we introduced the ulcer bill, and we could have not had the funds to do that without the Western, as well as all our members. So with it, having the Western really helps support our patient population, keeping the door open to access to care, and letting us as podiatrists deliver what we know through education, training, and experience that we can do to really, really help patients. So I also want to thank the CPMA board and Michael Cornelison, because he's the new ED. Because during the tougher times, I hounded all of them. I go talk to every rep tell them they got to be at the Western, talk to every person and tell them they have to be at the Western. And now it's kind of turned around where our attendees number is up from previous years. Our sponsorship is up from previous years. And I'm pretty sure we're going to be a completely sold out show at the end of the day. So I really want to thank them too.
That's great. That's really good information, because sometimes when you go to a conference and you pay a fee and you go and it's a wonderful conference, you're not quite sure where the full loop is being completed. So that is so great that the Western is participating in advocacy at the state level. That's wonderful.
It's 100%. That's exactly what it's about.
Right.
And on top of that, then you get to have the opportunity to engage with new technology, hear from expert faculty, get your CME. I mean, that I actually was not familiar with that either, that was actually part of the NIDIS for this conference in terms of supporting all the legislation that is really impactful and has a direct impact on so much of what all of us do, and not just in California, but just in general. So thank you for sharing that, because that also, I was not aware of that either.
That's great. Yeah, it's really just for anybody that practices in California. It's really to help the association. But those that are actually in other states, have probably seen that California has led the way on certain things, and those have kind of carried over to other states. And so I know California is very proud of that, and we want to continue doing that. So this is what makes that happen. And as you said, the adjunct is that we just trying to make it better and better every single year. It's at a really, really fun place. If you wear a suit like I do around a conference, you'll get asked where you could get churros or where you can get into the gate. And I have to remind folks, like, I'm sorry, I'm not wearing any ears, right? So I work here, but I don't work here. But I can direct you this way to go to the monorail. Right? And for those that don't know, you have to point with two fingers. That's what Disney did, right? It's a good Disney fact, right, Joe?
Fun facts of Disney.
Fun fact of Disney. So you know the history of why they think he did that?
No.
Because he smoked. And so he was holding a cigarette. And so he would point this way.
Isn't that fantastic?
Now, my kids taught me that. So, good or bad, that's what you can learn online. But, I thought it was pretty interesting.
So Devon and Christy, we're gonna take this little episode and we're gonna jump the queue and we're gonna get it out to the public. One of our thoughts is, could we share with our audience? They can still sign up for the Western, right?
Absolutely.
And then in the hotel that everybody's staying at is
Disneyland Hotel.
Disneyland Hotel. Yeah.
Mm-hmm.
Okay. All right. Well,
or you can
the
see
Grand
it at California Grand, which is also a lot of fun. And it's closer to the park and you can sneak in from the back so you don't have to wait through a big line. So
attached to the California Adventure.
Mm-hmm.
Yes.
Yeah.
Yes.
They have a lot of the character stuff there for if you have kids and like all the breakfast things, like the princess breakfast and the character breakfast. All the things, Jeff, that we are just so excited about.
Yeah, I know. I just love it. And Joe, I'm psyched that you're going to be kind of heading up the discussion on social media.
I'm so excited to do this with Ebony. It's going to be just a humbling moment. Again, I mean, she's such a celebrity in the world of podiatry that I am humbled and grateful to be asked to be a part of it. It's going to be fun to kind of run it like a Dean's Chat feel, kind of conversational, like you guys have talked about, and the panel. I mean, the panel is outstanding. So again, kudos to you guys for truly picking experts that can comment on some of this in a way that's relevant and helpful to the audience. And I'm excited to learn from all of them, to be quite honest. So it's going to be fun. It's going to be really fun.
All right. So
we're lucky to have you. So thank you. Sorry.
I apologize, Devon. We're going to give you and Christy the last word. Anything else about the Western that everybody needs to know?
Christy, go for it.
Yes. Well, we have worked over the last year to put together something that we've just never really done before and integrate all of our regular biomechanics, but doing it in a different way, looking at surgical biomechanics and how that integrates, along with our trauma discussions on ways to do things differently. I think we've integrated a lot of our perioperative medicine information, just on updates on really current ways to treat different things. And then super excited about just our new ways of discussing great debate on reconstruction with Dr. Schubert, Dr. Christensen, and Dr. Hutchinson. And then our sports medicine, I think, conference is going to be great. If you haven't already seen the reel for that, which is on social media, Dr. Liebeskind and his connections have made a movie level reel for that. So I'd really encourage you to check that out. And then super excited again about our evening with influencers, really just staying on top of social media and how we can use it. And so excited to have you guys be a part of that as Dean Chat, along with Ebony Vincent with My Feet Are Killing Me, Savannah Santiago, who puts together newsletters, Steffi Casimir, who is one of our students that does a lot online, and then Martina Randall. Yeah, and Jake Wines are doing kind of different views of how to use social media in their practice and different types of practices that they do. So, I think it's a lot of new and old, and it's going to come together in such a fun place where you can merge family and education all at the same time. So I really encourage everybody to come sign up. We're really happy to have everyone there. And I'll leave the last word with Devon because he's always very poetic.
I don't know. That was great. I was actually just going to say ditto. Fantastic. And I also want to let folks know we have not forgotten about bunions. We're going to have a really, really crazy bunion debate. If anyone looks at the panel, all these folks are highly definite and opinionated in a positive manner. And they're all going to be talking about a different way to approach bunions. So we kind of jokingly say like more debate than a presidential election. So it should be good. It should be a positive, fiery lecture. And as Christy said, we just look forward to seeing everybody there. We've tried to incorporate this into something, no matter what you do in podiatry, that it's going to just all be at the Western for you. And it's all going to be intertwined like a good Seinfeld episode. Okay. Thank you guys so much for having us. Really appreciate it.
Thank you so much.
Thank you, Joe. Any last words on your end?
No, I love what you said there, Christy. It's like the alignment of work, kind of getting to nerd out about new things and fun discussions and family time all in one experience. And that's kind of the future of, I think, where successful professional development's going to be. So really excited about it.
Thank you both for joining us, taking time out of your busy schedules, and looking forward. I'll be there a couple days early, like the CPMA board meeting, but I can't stay for the weekend. But I'm sure I'll be bumping into you.
Oh, we'd love to see you.
Absolutely. Yes.
That sounds great. Well, thank you again for joining us. And for all of our listeners, please give us a 5-star rating on Apple or Spotify. If you are on YouTube, we'd love to have you as a subscriber. We'll continue to bring you leaders in the profession and the top conferences coming up for your continuing medical education requirements. We were introduced to a new tagline earlier today: "Start your day the Dean's Chat way." So we're going to send you, Christy. You'll get another cup. Devon, you're going to have to be. You're going to be working around the clock here this next month. So you're going to need it.
I'm going to need that cup. That's right. It's one of my best friends.
I'll be double fisted. I love it.
I love it. All right. Thank you so much again. And we'll see you next week, everybody. Cheers.
Thank you.
Cheers.